Hi, I'm Maree from Switch On Health. Today I'm going to talk to you about the remedy Allium cepa, which is the common onion. So Allium cepa, or the onion, is prepared from, well, the homeopathic remedy is prepared from the common red onion, a member of the Liliaceae family. Now the remedy is made from the juice of the fresh onion bulb, and onions have had a really traditional use for a long time. So, many years ago, ladies used to bind onions on the ear for an earache or around the neck for sore throats. For onion, it's frequently indicated in almost every climate for the effects of cold. To put onions in socks for colds and coughs. So you can see it's an upper respiratory remedy that you would consider. Persistent cough, they used homemade onion syrup. So the doctrine of signatures, which I'm sure you're all really well aware of, is that when you cut up onions, what happens? Your eyes just water, they're irritated, and you kind of got to stop. So here it's a great example of doctrine of signatures where it irritates your eyes, the nerves are irritated, can make you cry as a defense mechanism. So, it's really trying to stop that onion that's trying to get into the eyes. So it's a powerful expectorant. Plays a significant role in the treatment of respiratory ailments. And these are upper ailments, upper respiratory ailments such as colds, cough, bronchitis, those kind of things. Also can be used, people use it for hay fever. So it fights off bacterial and viral infections. So Allium cepa, the mental and emotional symptoms, there aren't many. Usually you will differentiate when you're taking the physical symptoms that you will also look at the mental and emotional picture. But this is kind of really light on. There's not much. It's really, in some respects, very much an acute remedy where all remedies, I say, can be used constitutionally, but this is probably one that I wouldn't consider. But who knows, it can be used. So it has a light, almost everyday mental picture in the classical texts. Very little way in the deep pathology or that being unknown at this point in time. So the mentals are really overshadowed by these overwhelming physical symptoms. You know what happens when you cut up onions, right? You're just overwhelmed by what's happening. So that's where this is expressed. It's irritability, especially when suffering physically. Difficult concentrating, they can kind of feel confused, they can make mistakes, but that's with a lot of remedies, but it is there and that is part of this small mental picture. So there's a dullness or fog that accompanies this acute catarrhal states. There can be this sleepiness that happens if you eat onions. Apparently, you can feel really sleepy. So that can be very much associated. But again, it's a physical symptom. So at times it has been noted and appears improving. There's a slightly silly, reactive, talkative state, but it's mild and it's not a keynote. So don't use that. There's a lot of other remedies that can be used in that kind of way, maybe high sinus or something like that. So the physical symptoms is what you really need to concentrate on. This acrid, burning, excoriating nasal discharge. It's bland, copious, and it's watery. So really make note, this is very important in the differentiation, that this nose is basically just running like a tap. There can be constant sneezing, and this irritation can extend to the larynx. And so the catarrh descends from the nose to the throat, but it still stays in this upper respiratory area. So the local affinities will be nose, where there's coryza, hay fever-like states. So always even differentiate whether this is hay fever, whether it is a cold. I think that that's really important because you need to be able to treat this constitutionally. So if, say, they had a chronic cough, but this is an acute flare-up of this chronic cough, then you need to actually treat that most likely with another remedy. But if you want some relief, you're going to use Allium cepa at that point in time. Just for, say, hay fever, that does need to be constitutionally treated, but I'm going to talk a little bit about that later in some slides. So there's the local affinities, which is the nose, and then the eyes, right? So this is a lot of tears, the eyes really sensitive, photophobia from this irritation. So it's not really an inflammation, but an irritation to those nerves. And this larynx, which is this tickling cough, hoarseness. Sometimes they can hold their larynx and kind of explain it's like a hook or something. So there can be quite an intense feeling in the larynx. And then there can be neuralgia shooting from left to right. The nose can start blocked in the left and then move to the right. So it has that tendency to move left to right, but often very much starting on the left side. The shooting from left to right, this is also not used as a classical note, but it's there just again to sort of confirm that left to right thing that happens. Right, so Allium cepa, the modalities, this is really helpful, right, in differentiating in practice, right, with any remedy. So always look at the modalities, especially in an acute case. Open air, they're better for cool air, cold room, walking outdoors. They're worse indoors, warm rooms, in the evening. And and most likely it will start late afternoon, evening, so they're worse then. And again, it will start most likely on the left side. So Allium cepa, the main indications, and this is really important polarity to think about. This single polarity will make your decision. And so what I've done is that I've given you Allium cepa and also Euphrasia, because that's another one that can look really, really similar, and you might be considering it. But it's a really good example of the difference in the physical symptoms that occur from Allium cepa and Euphrasia. So with Allium cepa, and you really please keep this in mind, the acrid nose discharge, so it's burning, and they have bland tears. So it's just tears streaming from the eyes, where Euphrasia has a bland nose discharge, but the tears are burning, right? That's that raw sensation. So the nose with Allium cepa is burning, it reddens, it chafes, the upper lip can become sore, and that will be from that acrid nose discharge. And the eyes water, but they do not burn. Whereas in Euphrasia, you see a bland discharge, but acrid tears, and the eyes are burning, they're irritated. The nose discharge is mild and bland. So Euphrasia has a very strong eye-centered picture, and they're worse for wind. So what I've done here is I've given you a little table just with some acute differentiation, and this helps you even maybe to consider other remedies, but what you sort of need to be looking for as if you need to prescribe Allium cepa. So again, the nasal discharge is acrid, watery, and profuse. So it runs like a tap, right? Where Euphrasia is bland. Sabadilla is watery and thin, so it can look quite similar, and Arsenicum can look similar to Euphrasia because there is this acrid burning rawness that occurs. The eye discharge for Allium cepa is bland, where Euphrasia, as I said before, is burning and the eyes are a lot more irritated. So here we see, right, the primary focus for Euphrasia will be the eyes, where Allium cepa, it will be the nose. Sabadilla can be the nose too, but it's going to be itching. And arsenicum has burning everywhere, right throughout. the system. So those are the sort of differentiations you need to make. So the key sensations for Allium sepia are burning and raw. With Euphrasia, it's burning eyes. Sabadilla, itching, right? And Arsenicum's burning and anxiety, as we may or may not have learned as yet. But Arsenicum has a lot of anxiety and a lot of burning. So you need to kind of differentiate that. And this is where you might use the mentals for Sabadilla or Arsenicum as an example to try and help differentiate which remedy you might need to give and whether Allium sepia is a really the preferred remedy. So again, the modalities I've just listed here, and they can look similar. So you've got to sort of take all of this into account and see what the totality of the symptoms are as to what might indicate Allium sepia. So Allium sepia, as I said before, they don't have a huge mental picture. They can be kind of irritable, but there isn't a lot, they're very annoyed they have this. Euphrasia, they're kind of indifferent. Sabadilla has a better mental picture, but you will see that they might, when being sort of hypochondriacal, is that they might think that they've got some really weird imaginary disease. They can have delusions that their body parts are kind of shrunken or deformed. They can even think that they're pregnant and they're not pregnant. So you can see there's a big difference there when you're looking at that mental and emotional state. Arsenicum, again, we know they're anxious and they're very restless, right? They have to keep moving. They're not happy. Even you can look with arsenicum as to, if they have a cold, what they want to drink, all those sorts of things, and how they're drinking. So what I wanted to briefly mention, because Allium sepia is a really good example of the ideal direction of cure when we're looking at giving a remedy to a patient and then watching that result and making sure that we haven't suppressed or palliated and we're not pushing the disease back in. So without going into too much detail in regards to Hering's law or direction of cure, basically you want to see everything come from the inside to out. So you want to come from the most important organs and go to the least important organ, which is the skin. You don't want to see it going back the other way. So you had a skin condition, something like that, and the skin clears and you think, great, done, wonderful job, but their mental and emotional state may not be good. So you can see the direction of cure has kind of gone the wrong way. And also too, it's well known that if you treat a skin condition, say with steroids, and the skin condition clears, eczema, but what happens is that that patient may get asthma, or they've had asthma previously, it's gone to the skin, then it's been suppressed or palliated, and it goes back to asthma. So anyway, I won't talk about that much longer, but it's also, I really want to, really want to make sure that you understand that you always look for this direction of cure. And so that's why it's so important with the follow-up after you've given an acute or constitutional remedy. It's so important to really look at what the body is doing. So a well-resolved Allium-style acute case typically shows, right? So the disease remains peripheral. So we can see that it still stays on that kind of physical element. It's not going into a deeper organ. It's not going down into the chest. There's nothing really chronic about this. The reaction increases outwardly, so the streaming increases. So this is where you get these discharges, the sneezing, the burning. The symptoms then shift downward, so the eyes clear before the nose, and the nose clears before the larynx. So you're seeing it moving down, and that is also part of that direction of cure. And the last irritation felt is the earliest to leave. So Not, I have seen it a lot, but sometimes that doesn't occur, but I won't go into herrings any further. And what happens is that you have this restoration of health, all right? So the system softens, the calmness resurfaces, and that balance is restored because always what you're doing with any remedy, whether it's acute or constitutional, you need to see that vital force, that energy force being come back into balance because that's what we're doing with homeopathy. So the key rubrics, I've just listed some rubrics here, most indicated. This isn't from a particular repertory, and the repertories are where we have our symptoms and we go to look for really particular individual symptoms. So these are just kind of broad ones. Every repertory is different in their structure, sometimes the wording of the rubric or the symptom, but basically the nose symptoms here, we'll see that you capture that characteristic nature. It's irritative, burning, and there's copious flows. So you can see watery, profuse, the discharge is acrid, excoriating, freezing, sneezing is frequent. In the evening, that they're worse, which I mentioned before, worse in a warm room, and they're better in the open air. Now, the eye involvement is secondary. So we saw that Euphrasia is first, right? So the eyes water without burning. So just be really careful when you're taking the case to get all these little details because they're going to be so hugely helpful. And I think already you can see how different it is and what you need to get. And the other thing is too, being familiar with a remedy helps you ask the patient, well, how is the symptoms? What's happening? Is there burning? How much is it the nose discharge or the eyes? Okay, so, this eye discharge is bland and it's better in the open air, and indoors it's aggravated. So that just gives you some key rubrics and a good idea about Allium cepa. So we know, and I've talked about already, that it's short-acting remedy. So what I'm using today is that you might use Allium cepa as a case that presents with hay fever. Now, basically, and this can do with the chronic cough, not just hay fever, that it's really an underlying state of the chronic condition. It's a soric manifestation showing itself on the surface. So short-acting remedies may offer some temporary relief, but they don't address the underlying condition. And it's really important to know the difference between an acute and know the difference between chronic. So acute basically is survive or die, and a chronic condition is something that slowly becomes worse over time. So it's a really big difference. And so hay fever is a really good example, or say a chronic cough, that you have these flare-ups that occur. And it's not then the best time to take the case. But you need to be aware of this because they need to follow up with a constitutional remedies. So to treat hay fever or a chronic cough, for example, is after the acute phase has passed and before the next seasonal reoccurrence. So say, for example, there was a hay fever flare-up, had all the symptoms of Allium cepa, helped beautifully. Next season comes around, they go to use the same remedy, or you might prescribe the same remedy, and it doesn't work because you haven't treated that underlying chronic soric state, that chronic condition. So you must wait for the acute symptoms to settle. So then you can identify the patient's deeper remedy. So during the height of attack, it's challenging because the physical symptoms, especially if you're going to use Allium cepa, they just override everything. So it becomes difficult. And so just be mindful of that because really what it's doing is mimicking an acute illness, but it's not an acute illness. So That's what I'm saying. A deeper acting constitutional remedy, one that corresponds to both the individual and their general pattern of symptoms, is needed for a long-lasting change. So it really needs to be the case taken, so they can restore that balance really well, rather than continually having these attacks. So I hope that you enjoyed the onion and a little bit about how to use Allium cepa, and also to just be mindful of those few things that are pointed out through the PowerPoint. So have a lovely day and learn more with Switch on Health.